All right, here we are in chapter 6. This is medical nutrition therapy for diabetes, cardiovascular disease, pulmonary, and the first section is on obesity. Before we get to specifics on obesity, let's take a look at MNT, medical nutrition therapy. So your book defines MNT as a nutritional assessment and treatment of a condition, illness, or injury that places an individual at risk. And risk here, what we're looking at is their nutritional risk. So you can think of things like missing teeth, poor fitting dentures, swallowing problems, pressure ulcers. Those types of things would place a person at nutritional risk. Okay, there's two parts of MNT, and the first is assessment of their nutritional status, and the second then is what we're going to do about it. How are we going to intervene to um, improve that person's nutritional status? So, in the example that I use, someone with um, swallowing problems, that's our assessment that they have that swallowing difficulty. Our treatment and intervention is going to be to provide them with foods that are safe for them to eat. And so that might mean working with a speech language pathologist to provide a diet according to the correct thickness level of liquids and the correct minced, chopped, moistened level for the foods that they're eating. So the medical nutrition therapy typically begins with nutrition screening, and we'll talk more about that in Chapter 7. Treatments that we can suggest for medical nutrition therapy and implement. Therapeutic diet. So an example of this would be someone with hypertension, which is high blood pressure. We would recommend a DASH diet, which is the dietary approaches to stop hypertension. That's a lower sodium, higher potassium, less focus on meats, more nuts and seeds, and fruits and vegetables, and whole grains. We'll also provide counseling and support for that condition. So the first section that we're going to talk about in Chapter 6 is overweight and obesity. And this first bullet point, I have a love-hate relationship with this because people define overweight and obesity as when energy intake exceeds the amount of energy expended. Well, all of you know that this is a lot easier said than done, right? So we hear very often that it takes 3,500 excess calories to make 1 pound of fat, and conversely, 3,500 deficit of calories to lose a pound of fat. There's many other complicating factors, so it's not as straightforward as that. There is no single cause and no single treatment for obesity, but as we've exhausted at the early part of this semester, certainly our American lifestyle does not promote a type of diet that is helpful for maintaining an appropriate body weight. So, overweight or obesity, that could be defined by their BMI, which you all know how to figure out. We can also look at excessive fat around the waistline. So the type of fat that we carry around our waist is less metabolically active than fat other places. So the greater our waist circumference is, the more at risk we are for obesity-related diseases like diabetes, high blood pressure, cardiovascular disease. Please ignore these. This is a waist to hip ratio. What I want you to look at is a waist circumference, and a waist circumference greater than 40 inches for men and greater than 35 inches for females puts them at risk for those obesity-related diseases. So again, greater than 40 inches for men and greater than 35 for women puts at risk for obesity-related diseases. So some of the treatment options that your book goes through, and they do a really nice job of outlining the different types of treatments on page 134 to 136. Talks about nutrition education, exercise, behavior modification, attitude modification, social support, and drugs and or surgery. And we'll go through and talk about each of these. So meal planning. Most successful healthy eating options are typically following the AMDR, the acceptable macronutrient distribution ranges. You thought you'd have to forget